If your knee hurts when you climb stairs, not when you walk on level ground, not when you sit, but specifically when you climb stairs, your body is telling you something quite specific. It is not random, it is not just wear and tear. It is not what your friends will tell you, which is usually that you should rest more. Stair pain has a particular meaning, and once you understand what your knee is actually saying, you can make better decisions about what to do next. The kind of pain you have and when it happens tells you which part of your knee is in trouble. That is the first piece of information any honest treatment plan should start from. I am Dr. A.K. Venkatachalam. Let me explain what is happening when you climb a stair. As you push yourself up onto the next step, your knee bends to about 90 degrees and the entire weight of your body plus the force you generate to push up lands on a specific part of your knee. That part is the joint between your kneecap and the bone beneath it, the patellofemoral joint in clinical language, and the kneecap region in common day everyday language. On level ground, your kneecap carries about half your body weight. On stairs going up, it carries up to 3 to 4 times your body weight. Going downstairs is often worse, up to 7 times your body weight on a single bent knee, every step. So, when stairs hurt and walking does not, your body is not being random. It is telling you very precisely where the load is failing. There are 3 things that commonly cause this kind of pain. The first is the cartilage on the back of your kneecap getting thinner or rougher. Cartilage is the smooth surface that lets 2 bones glide against each other. When it wears down in the specific area, you feel pain when that surface is loaded, which is exactly when you climb stairs. The second is the bone underneath the cartilage being stressed. The bone underneath is alive. It feels load. When the cartilage above is no longer cushioning properly, the bone takes the impact and the bone hurts. The third is the muscles around your knee, particularly the thigh muscles, not pulling your kneecap in the correct alignment. The muscles around the knee don't pull your kneecap in the correct alignment. It should be centered. If it goes to one side, the cartilage underneath will start wearing. So every time you bend the knee under load, the kneecap is being dragged slightly off track. That irritates everything underneath. Most patients have some combination of all 3, rarely just one. Now, here is what stair pain is usually not. It is not by itself a sign you need a knee replacement. Most patients with stair pain do not need replacement, and many are offered it far too early. It is not by itself a sign that you should stop climbing stairs. The wrong response to a knee that hurts on stairs is to avoid stairs forever, because the muscles that protect your knee weaken when they are not used, and a year later the same stairs hurt twice as much with no arthritis having got worse. And it is not a sign that you need an injection of something, cortisone, lubricant, anything, just because the pain is in a particular place. Pain in one location does not mean a treatment in that location. Where the pain is felt and where the problem is generated are not always the same place. 3 things help in roughly this order. First, strengthen the muscles around the knee. Particularly the thigh muscles, the quadriceps. Strong thigh muscles change how force travels through your knee. They take load off the kneecap. This is the cheapest, most evidence-based intervention in all of knee medicine, and it is the one most patients are not properly told about. Second, examine the metabolic environment of your body. Sugar levels, vitamin D, inflammation, fat balance. These determine how well your cartilage and bone can repair themselves. A knee in a body with high sugar and low vitamin D heals slower. We can measure this. We should measure this. Third, if structural damage is significant, Consider biological treatment. Treatment that addresses the cartilage and the bone underneath in the body that has been prepared metabolically to support repair. Not before that, not instead of, after. That order matters. Most patients are offered step 3 first, with step 1 ignored and step 2 never tested. That is one of the reasons so many treatments fail. If your knee is hurt on stairs, here is what I would suggest this week before you do anything dramatic. Do not stop climbing stairs, but do not push through severe pain either. Climb at a pace your knee tolerates. Start strengthening your thighs. Even simple seated leg extensions done daily will start to help within 2 weeks. Get a basic blood panel, HbA1c, vitamin D, lipid profile. Most labs offer all 4 together cheaply. The numbers will tell you whether your body is in a state to heal. And before you accept any procedure for your knee, ask the question, is this addressing what is actually wrong, or is it only addressing where I feel the pain? Those are not the same. If you have been having knee pain on stairs for some time and the simple steps have not been enough, the next conversation is about whether your joint and your body are still in a position where biological treatment can restore what is wearing down. That is what we do at MJRC. The full PRASAD Orthobiologic treatment video is in the description below if you want to understand how. But start with the basics. Strengthen the thighs. Test the 4 numbers. Listen to what your kneecap is telling you about which part of itself is in trouble. Stair pain is information. Use it.